Hi, my name is Jenna. I'll be your student nurse today.
Hello.
How are you feeling today?
I'm good. How are you?
I'm good. Have you been sleeping well recently?
Yeah.
Good. Can you tell me your name and date of birth?
Michaela Gleason, March 1st, 2003.
Good. Alright, so today I'm going to be doing a abdomen exam on you. So I'm just going to be feeling around and listening to your abdomen. Does that sound good with you?
Yeah, that's okay.
Do you have any questions?
No.
Have you had any diarrhea or constipation recently?
No.
Or any change in your bowel movements?
No.
Any nausea or vomiting?
No.
Alright. Patient is awake and upright. She is alert. She is talkative. Skin tone is pink and tan. And she looks the stated age. Alright. So, if I can just have you lay down for me. Alright. So first I'm just going to look and... Thank you. You know the drill. Alright. There are no signs of scars or stretch marks on her abdomen. Contour is flat, stomach is symmetric, and her demeanor is calm, it's not moving. Alright, so next I'm just going to listen to your stomach. Alright, bowel sounds are normal and active in all 4 quadrants. And next I'm just going to listen one more time for any brutes. Okay, no brutes heard, or brutus heard. Alright, so next I'm going to percuss your abdomen. So I'll start on this side. Alright, so I'm just going to tap down on it. Alright. Percussing sounds are dual in each quadrant. Alright, next I'm just going to palpate, so I'm going to just feel around. Are you very ticklish at all?
Yeah.
Okay. I'll try to not tickle.
Okay.
So first I'm just going around lightly. Alright. Did you have any pain during that?
No.
Alright. No tenderness or rigidity in all 4 quadrants. And I'm going to push down a bit deeper. Alright, was there any pain during that?
No.
Alright, no tenderness or masses in all 4 quadrants. Alright, you can sit back up for me, and that will conclude your abdominal exam. Do you have any questions for me?
No.
Alright, thank you. Washing hands.